A lot of people have said that gamma is the binding rhythm, but actually gamma emerges from a network after it's bound. So it's not the thing that creates the network. If you create a network, you can't create it with a propagated rhythm that takes time to go from point A to point B. You can't instantaneously bind a network with something that's propagated. The infralow frequencies actually can create a network at a great distance because they can act as a field effect and act instantaneously. So I'm not here to teach you the gospel of neuroscience, which is that gamma is the binding rhythm. I'm here to teach you the heresy that it's not the thing that binds the networks. It's in fact an emergent property of being bound. There's obviously people here that have seen this, that temporal binding basically. This is the gospel of neuroscience, but we're here basically to also discuss other things in gamma. You're aware of Davidson's work on meditators. The Dalai Lama's monks generated huge amounts of gamma, and a surprising amount actually, larger gamma than Richard Davidson's lab had seen in normal humans previously. Now, I've also seen huge amounts of gamma from various drug experiments as well. Hallucinogens quite often alter consciousness, and if you alter consciousness, you're either altering the infralow frequencies or gamma. As an example, David Stuckey's PhD on ayahuasca, which is a hallucinogen, that they drink a tea, and it makes you sick, and then after you're sick, you have hallucinations. But the hallucinations are actually synesthesia. When you smell something, you see it. When you touch it, you smell it. So your normal boundaries between sensory areas are crossed. The gamma coherence crosses normal boundaries so that you actually bind networks that normally don't talk to each other. You know, when you touch something, you don't necessarily taste it. But if you have synesthesia, the sensory boundaries are crossed. And you see that as gamma coherence. Actually, when he collected the data down in the Amazon with the shamans hallucinating on ayahuasca, he had carried a big Lexicor amplifier out in the jungle with generators and everything, and it went to this great extent to record 2 people hallucinating on ayahuasca. And he got the data back but in one last attempt to salvage his PhD, I'd written the book on the art of artifacting, so he brought the data to me, and he said, well, just tell me this is crap and I'll leave you alone, you know, and I'll go figure out another dissertation. I looked at it and I said, no, this isn't artifact, this is hypercoherent gamma. And he said, well, Frank says it's EMG. How can I prove that it's not EMG? Well, it's hypercoherent. You can't create coherence with random frequency spiking muscle plate potentials, but gamma, on the other hand, is synchronous and creates a coherent waveform. And the EMG, which was present in the temporal areas, was not coherent, but the gamma everywhere else was. So, and with that argument, he basically ended up with his PhD, which is a nice little trick, you know. So, but there are a lot of people that were saying gamma is good. Well, is it? Well, you can train it up. Neurofeedback has shown you can train it up. If it's good, you should train it up. It'd be better, wouldn't it? Well, I don't know. It's also good because you can see it in meditators. Beverly Rubik showed that, and you can actually also find that gamma is associated with people's responses to drug cues. So it's not always good. Maybe it's also somewhat bad. How about the fact that gamma is excessively present at a seizure focus? Well, maybe that's not so good. How about the fact that you see excess gamma in Parkinsonism? Maybe that's not so good. How about the fact that you see excess gamma in Alzheimer's dementia? That's not so good. How can you tell the difference between schizophrenics' gamma and meditators' gamma? How can it be good and bad at the same time? Well, first of all, set your value judgments aside. It's not good or bad. It's gamma, and it's situationally either appropriate or not. But you can tell if it's an appropriate neurophysiologically healthy form of gamma or not by looking at the dynamics of the gamma. Here we see nested rhythms. The distance between these is about 200 milliseconds, so that would be a fifth of a second. So this is about a 5 hertz rhythm. Theta happening in the limbic. The hippocampal septal neurons are firing in the theta frequency. But you'll also see at about 100 hertz, gamma is being modulated by the theta. This is phase amplitude coupling. It's a form of cross-frequency coupling. And healthy gamma occurs in brief bursts called chirps. Now, nested rhythms and chirps, it sounds like we're a bunch of bird brains, but I didn't make these terms up, I just report this stuff. So what you basically have is the phase of a negative up in EEG land is negative. So a negative half wave ends up being an on position, and a positive half wave is an off position. So if the infralow frequencies are electronegative, it turns on the brain area. When it goes electropositive, it dims out the brain area. So the infralow frequency can turn on and off, modulating the faster frequencies of the oscillating EEG. And the nested rhythms basically include theta nesting gamma, infralow frequency nesting all of the AC EEG, alpha nesting gamma. So this phase amplitude coupling is one form of cross-frequency coupling. It appears to be one of the more important forms. There are other forms as well. As an example, in clinical work, this is work from Dr. Kropotov, Yuri, back from 2000. And this is a normal patient. This is a normal person. This is not a patient if it's normal, I guess. And this is a high-functioning ADD and a low-functioning ADD, as judged by their continuous performance task performance. So this is not, judging clinically how severe the ADD is. This is judged based on performance, not a subjective judgment, an objective measurement. And he basically, his intention in the study was to show that the beta synchronized at about 500-600 milliseconds into the task. On a normal person, it was later and later and later as the severity of the ADD got worse. But in his data, if you look carefully, the high frequencies up to 74 hertz, this is gamma, all the red content up at the top. This is a JTFA, a joint time frequency analysis with frequency and time. This is 1,100 milliseconds, so the first 100 milliseconds is base period. The next 1 second is a response to the stimulus, and this is a go stimulus, and he has to press a button. Well, the normal person has 1, 2, 3, 4, 5, 6 bursts of gamma. That's gamma nested in theta. And these bursts are happening in a healthy individual. If you look down at the high-functioning ADD, 1, 2, 3, 4, 5, 6, but they're very weak. Anybody here train gamma in ADD? Aha. Well, one person on the right track, the rest of two. you might consider it because, look, it's directly related to the attentional problem. And gamma training in an ADD person is an important aspect of it. So you might think beta training is one of the things that's been done traditionally, but gamma is an important aspect of this as well, as you can see. And the gamma is nested in theta.
Question.
Really loud.
Oh, yeah. Just a quick question. So are you saying that gamma, in this instance, is showing that a network has been bound based off, whatever, so it could be in theta, and it's a confirmation that that network was formed, and activity took place, and then maybe the next one and the next one and the next one. So by training the gamma, which is the end product of the network being bound, is helping the network to bind, even though gamma is not the thing that binds the network.
No, it's looking at the output, but you're tapping into the phenomenon that you need to work with, basically. Right. And years ago, before ADD was a real good diagnostic category, back in the early 70s, there was a physician in Houston, Texas, Dr. Shear, who had a device that would train gamma. And the school system in Houston basically gave him the students that were declared minimal brain damaged. If you remember back there, this was, ADD was minimal brain damage back then. And mild retardation, I mean, great terms, wonderful diagnostic workup, but the school system would kick them out into his training. And he would basically look, if they had some gamma but not much, he would train them gamma. If they didn't have any gamma at all, he assumed they were damaged goods and he wouldn't work with them. But if there was some gamma, you can operantly train it. And he took the ones who had some gamma and he taught them for about 6 months to a year in his program. And at that point, they were kicked back into the school system where they rated them without necessarily knowing that they were anything other than a normal student. And they were at superior academic levels, as opposed to being brain damaged and retarded. So the gamma training was very, very useful. The device he had basically looked at 40 hertz. It was a big round amplifier box that hung on a string around your neck. They nicknamed it the albatross because it hung around your neck. It was a heavy old amp and your brain was plugged into it. But it measured hertz and 70 hertz. And if it saw 70 at the same time as the 40, it assumed it might be muscle, so it wouldn't feed it back. But if you had 40 without the 70, it would feed it back. And again, with that training, he actually got students well. They become normal, whatever the hell that is. So nested rhythms are an important thing. Actually, Aspect Medical makes a device that they measure surgical depth of anesthesia with. And if you're doing same-day surgery, if you use this device to tell you that you're deep enough in anesthesia, you get a better outcome. They don't have to spend the night in the hospital, and they don't remember the surgery, and they don't move. And surgeons don't like people moving. Moving target's no good, especially if you're doing brain surgery. By the way, if you need brain surgery, I recommend it highly, but if you don't need it, I would avoid it, But they basically looked at the cross-frequency coupling between 0.38 and 38 hertz, infralow and gamma. And the math was easy with 0.38 and 38. They looked at a correlational measure between them, and that basically told them whether they had gamma that was nested in infralow frequency or not. And if it was, you were conscious. If it wasn't, you weren't. So it's measured as a measurement of consciousness, basically. And then obviously, we can actually look at the gamma wavelets in a theta nest, and the number of wavelets in gamma in the theta nest determines your digit span. It's like a register that can hold a certain number of digits, and it can hold typically about 7 wavelets. If we go back, 1, 2, 3, 4, 5, 6, 7. 7. How many digits do you normally remember? About 7, which is why that's your number of digits in most phone numbers. So people have difficulty with larger strings. So.
Can I just make a comment? Dirk was saying that the gamma is for error detection, and people with ADHD don't tend to have that ability to detect error. So I can see why training that is very good, and I can see why training it too much could actually put you into an OCD type state or not.
If you train gamma to be on all the time, it's not healthy. But if you train more gamma in a Fourier, you can't tell if it's happening in brief chirps or not. If you train it and you actually look at it with a wavelet analysis, you can see that it's happening in discrete packets, and you can tell healthy from non-healthy. I think there's a hand up in the back as well. Really loud?
Jacob, how do you explain the extraordinary cases?
I'm sorry, a little more.
How do you explain cases of extraordinary memory, working memory?
Obviously gamma 2 gives you more wavelets. There are people that end up remembering better. I don't know whether anybody's ever shown that they actually have more wavelets in their nest or not, but that appears to be the limitation. So, published in Nature in 2009, they basically showed using optogenetics that if you ping the network, it resonates with gamma. Gamma is a resonant property of having a bound network, and this is one of the papers that showed that to be the case. Basically the difference is dynamics. Healthy gamma is phasic. It occurs in brief bursts. Pathological gamma is tonic. It persists. Kind of like the difference between frontal midline theta, which is a healthy theta at the frontal midline. It occurs in people that have a memory task, and it generally correlates if it's prominently present with a lack of anxiety or worrying, which is a very nice thing to have if you don't want to be anxious and worrying. Frontal midline theta in phasic bursts. But if you have tonic theta frontally, that's more like ADD. So the dynamics end up telling whether it's good or not. And then obviously Alzheimer's, epilepsy, Parkinsonism, tinnitus, pain, depression, they all have a common failure mode, which we'll talk about as the lecture goes forward. On the left side, we have, this is Rudolph Elena's MEG work. This is a bispectral plot. This is from low frequency to high frequency, and this is low to high, same frequencies. Content should be along this diagonal line. This is 10 and harmonics up near 20. And 20 relates to 20, 10 relates to 10. So you get activity along the 45-degree angle line. This is all controls added together, and you can see basically the same pattern as this individual. This is a Parkinson's patient. Now, if you know anything about Parkinsonism, you know that they basically freeze. And those frozen postures, that's a network that's bound and locked. They lose the dynamics. So they end up making an excess amount of gamma because their networks are locked. They're bound. There's no more dynamics. So it's not going on and off. And this is all patients regardless of diagnostic category. You can see the flare pattern here as well. We'll talk a little bit more about this, but Canole T's work on cross-frequency coupling is something I would recommend that you use as a reference. Some of his work is some of the best work on cross-frequency coupling. And as an example of it, you can see that in the front of the head, gamma is nested in theta. In the back of the head, gamma is nested in alpha. So perceptual packeting is sensory, that's gamma nested in alpha, and motor function and memory and so forth frontally is gamma nested in theta.
We've been talking about gamma the whole time, and you've just shown the cross-frequency analysis in Parkinson, and the frequency went up to 35 hertz. Can we take a second to define what gamma, what the frequency range is that you describe as gamma? Because now we're looking at frequencies up to 250 hertz.
Sure. You'll notice here that the gamma if this went up higher, you'd end up seeing that gamma occurs in sheets. It goes up. And it starts in the 30s and it goes up. The difficulty is that differentiating beta from gamma at about 25, 30 is difficult, but as you get up into the 30, 35, 40 hertz range, it's more clearly gamma. Now, in Europe, the people who work with gamma, they'll kind of scoff at you if you talk about 40 hertz gamma. They want gamma 2, 80 to 100 hertz. That's what they consider real gamma, because you can easily differentiate it. So it's a complicated answer, but that's neuroscience for you. It's complicated. If it's a simple answer, it's probably not true. Gamma 2 is not the fastest rhythm. You actually go up above that. There's ripples, which are faster frequencies, and we'll talk about the meaning of some of these as we get into the lecture. I don't want to step on Dirk's material. Well, actually, we step on each other's material, but I don't want to ruin it for you. He's got good stories too. That's enough talk about the rhythms and their generators, and a little bit about cross-frequency coupling. And I'll kick this back to Dirk, who can resume uninterrupted for the moment.
And then the question is, what is the function of all these frequencies? And that, of course, depends on what they're nested. But to keep it very simple, the lower frequencies are often involved in reward and in autonomic nervous system processing, whereas the theta is usually related to limbic or memory information processing, and the alpha is depending on which alpha. It can be related to internalized attention, or some people also suggested actually a kind of a sensory scanning. Beta 1 has been suggested to be status quo. So if you make a prediction and the prediction is correct, then you have a status quo of the information processing. If you make a prediction error, basically it just means that what you predict is wrong, which means that something has changed. Then gamma can be a reflection of change. Whether that change is good or bad depends, of course, on whether you need that activity or not.